95.9 WATD, the South Shore's Morning News. I'm Rob Hackler with the morning team. And now, as promised, our Living and Practicing by Design segment. We do it on Thursday mornings at this time with Dr. John Hayes. For a better experience at the doctor's office, try Dr. John Hayes' new, highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com. That's drjohnhayesjr.com. There he is, Dr. John Hayes. Good morning.
Hey, Rob. Good morning.
Good to see you.
Absolutely.
And
glad to be here.
As promised, this week we were going to talk about plant-based diets. You sent in here, and the question is, can plant-based diets reduce heart disease? It would certainly seem like it could. What do you have for us?
Yeah. So, Rob, I mean, it's a long research project. It goes back many, many years, oftentimes not discussed in the media so much at all. But the reality is, on a very simplistic level, plant-based diets have been known for many, many years to reduce the incidence of heart disease. Mm-hmm. And there's some variants of the plant-based diet, the Mediterranean diet, which is the most widely studied, pescatarian diets where patients eat, mainly plant-based, but add some fish here and there and that type of thing. But the bottom line is that a plant-based diet, in other words, a diet that's primarily made up of fruits, vegetables, whole grains, and plant-based sources of proteins, are far healthier for us for many, many reasons overall.
Okay. What is it about the plants? Is it why is it? Would it be better? What is it in the plants?
Well, so there's a lot of substances that are contained in plants that are primarily anti-inflammatory agents.
Okay.
So this would include like some of the things that you see in plant colors, some of the things you see in certain plant-based oils, like olive oil in particular, and so on. So the substances contained in plants versus substances that are contained in meat products in particular tend to be far healthier for us overall. Now, this does not necessarily mean if you don't want to be 100% plant-based, you can never eat meat. What I tell patients to focus on, Rob, is to just really look at what you do most of the time. Forget about the occasional out to dinner, forget about the occasional party or so on. But the biggest thing is to stay on track. Hands down, that's the most simplistic approach.
Because there are some people that choose to eat only a plant-based diet, and it could be for health, or it may be other issues related to consuming animal meat. But you're saying you don't have to be a full vegetarian, Sir Paul McCartney, if you don't want to.
No, you don't. And it's a choice. It's a choice. Is it healthier to be 100% plant-based? It turns out it probably is. It probably is.
But again, the idea would be a plant-based diet to be the majority of your diet as opposed to the prime rib diet or
something.
Okay.
Correct, exactly.
All right, so what about some of the other things you were saying? Anti-inflammatory, which is good. We know that helps so many areas. And then you said lowering cholesterol and blood pressure?
Yes. So there's really good evidence that plant-based diets help to lower blood pressure dramatically. In fact, this is something I see in my practice all the time. Actually, since I just started in September in Marshfield here, lots of patients that were able to reduce or get off blood pressure medication by guiding them and walking them through changing to a plant-based diet. Huge changes, which is a big one. The other thing, too, is, like we talked about in this article, is weight management and so on. But I think the key takeaway of this, Rob, if I may, is enhancing endothelial function. So endothelial function basically means the lining of the blood vessels or the endothelium is what gets damaged in an inflammatory diet. And inflammatory diets in this day and age are all over the place because of primarily highly processed foods. That's the bottom line.
Okay. What would be some of the bad things then that you're saying that's a very do you have any examples?
Yeah, exactly. Probably the biggest example would be, even let's take a look at some plant-based products. If you take a look at some of the artificial meats, so to say, and you buy it because it looks healthy, but you look at the label and it's loaded with canola oil, sunflower oil, and so on and so forth, that are known to be very pro-inflammatory. And the same thing goes for the vast majority of our snacks, chips, crackers, cookies, etc. That's just laden with it. And the other big one that a lot of people are getting in trouble with is they switch from cow's milk because I heard it was good for them. They go to plant-based milk and they're drinking almond milk or oat milk that's loaded with a seed oil. Not cool. So, so it's something to really, really be very, very cognizant of. And I find many times one of the first steps in helping patients not only feeling better, but with weight loss is to get them off the seed oils. It makes a big difference.
Really?
Yep.
Okay.
Yep.
All right. Well, these are the important things as we talk about. Every patient is different, and you need to talk with your own doctor or, of course, make an appointment to see Dr. John Hayes for specific medical advice. And we talk about this as an overall conversation because it is good to have these conversations. And you're right. And it certainly makes sense to avoid things that cause inflammation. And this is an example also, and I suppose you must hear this, is that sometimes without getting all the information, things we think we're doing to make changes or better could in turn be worse.
Exactly. And unfortunately, it's all over the place now, largely because of
marketing.
Yeah, marketing, the internet. I mean, you name it.
That's true. Yeah, you got to be careful as we talk about what you read, because you can Google something and there's just a ton of wrong information. Now, I'm not saying it all is, but it's very hard to do the research yourself.
Right. So the idea is to get in the habit of reading labels and diving in, because sometimes even the labels aren't as thorough as they could be, and you go and you search the product online, you do a deep dive, and you find out what's really in there.
All right. We got a question from Diane from Marshfield. Again, if we have questions, if it's something Dr. Hayes can't do and right away, we'll get to it in a future segment.
Sure.
This is Diane from Marshfield and wants to know, what about cashew milk or coconut milk? Cashew milk or coconut milk?
Well, cashew milk, you want to be careful because it can have seed oils added to it, but coconut milk in limited quantities can actually be pretty darn good. I mean,
really?
Coconut oil has what are called medium chain triglycerides, which can help with fat burning. They can help with satiety, how we feel, and so on and so forth. So, yeah.
Okay.
Yep.
All right. So in limited quantities, Diane, that coconut milk sounds like it's good.
Probably better. But again, you have to read the labels. You've got to know what's in there.
What else is in there? Yeah.
Exactly.
Yeah. Oh, it's so important. So important. All right. Well, thank you, Diane, for that question. Any other information that we wanted to get out in this segment, Dr. John Hayes?
I think the most important thing, Rob, is that everybody's an individual. And one of the things you need to know about going plant-based is you've got to have your blood work checked. You just do.
Yeah.
Because commonly we're seeing more and more instances of neurologic issues, even in younger people with B12 deficiency, believe it or not, or low B12 levels in all aspects of health, mental health, physical health, you name it. Iron levels sometimes can be difficult to maintain at a high level in a plant-based diet for some people more than not. So just having somebody you can work with professionally, have an initial baseline set of labs. Exactly.
Do
and
they
then
test for all these things, or what do you have to ask
I do.
for?
Yes. No, I do.
do.
Yeah, absolutely, positively. Yeah, check for all the nutrients, B12, folic acid.
What are my
vitamin,
levels?
Yeah, vitamin D and so on, and some for other patients at higher risk, a deeper dive, of course.
All right. Text line is 781-837-4900, and keep in mind that Dr. John Hayes is going to be in studio with us every Thursday at this time for Living and Practicing by Design with Dr. John Hayes. Dr. John Hayes, tell us more about where you're located and how we can get in touch with you.
Yeah, so we're at 475 School Street, Suite 7 in Marshfield, and the easiest way for people to get in touch with us on any day, really, is to just shoot us a text first, 781-659-7989. If you'd rather phone and leave a message, you can do that, and we'll return your call as soon as possible. Plus, you can also reach us directly through our website. You can open a chat, and again, if we're live, we'll get back to you then. If not, we'll get back to you ASAP.
Wonderful. Dr. John Hayes, drjohnhayesjr.com, drjohnhayesjr.com is the website. You can get more information there, and Dr. John Hayes is going to be in studio with us every Thursday at this time on WATD. Thank you, Doctor.
Rob, thanks so much. Take care.